What is bipolar depression? Bipolar depression refers to the lows, or depressive phase, of bipolar disorder. Bipolar depression is different from other forms of depression. There are many forms of depression. Unlike unipolar depression, bipolar depression is part of a larger condition known as bipolar disorder. Knowing what form you have is important because there are different treatment options for different types of depression. Be sure to ask your doctor about how these options work differently to treat unipolar versus bipolar depression. Understanding the larger condition, bipolar disorder. Bipolar disorder, the larger condition that includes bipolar depression, is a lifelong, or chronic, illness. It's a condition that affects the brain in a way that can cause extreme mood swings that vary in length. People with bipolar disorder can go from mania, the highs feeling euphoric or revved up and irritable, to depression, the lows feeling down or hopeless. These highs and lows are called episodes. Here are some important facts about bipolar disorder. Affects about 12.3 million people in the United States and as many as 60 million people worldwide. Half of all patients begin seeing symptoms between the ages of 15 and 25, but it can begin at any age. There is no cure, but for many people the symptoms can be controlled with treatment. Bipolar disorder is sometimes referred to as manic depression. Some people may experience mood swings that are less extreme than a full manic episode, known as hypomania. People with bipolar disorder often also have other mental health disorders. Could you have bipolar depression? Figuring out whether you have bipolar depression can be a journey. The important thing to remember is you're not alone. Others have traveled the path to a diagnosis, and it started with talking to their doctor. There is no one test or quiz to diagnose bipolar disorder. However, answering this questionnaire and bringing this guide with you to your next doctor appointment may help you be more prepared. Effective treatment starts with your doctor. If you're already diagnosed and still struggling with symptoms of bipolar depression, you can take steps to change that. Speak to your doctor about how you're feeling and what you can do. What you can do to help, starting now. If you are struggling with bipolar depression, help get the conversation started using our doctor discussion guide. Track your moods day by day with our daily mood monitor and go over the results with your doctor. More signs and symptoms to watch for. The signs and symptoms of bipolar disorder are different depending on the type of episode, that is, manic or depressive. Each episode marks a drastic change from the way a person usually acts and their typical mood. The highs, mania. Symptoms of a manic episode may include feelings of euphoria, abnormal excitement, or elevated mood. Talking very rapidly or excessively. Needing less sleep than normal, yet still having plenty of energy. Feeling agitated, irritable, hyper, or easily distracted. Engaging in risky behavior such as lavish spending, impulsive sexual encounters, or ill-advised business decisions. The lows, depression. Symptoms of a depressive episode, bipolar depression, may include no interest in activities you once enjoyed. Loss of energy. Difficulty sleeping, either sleeping too much or not at all. Changes in appetite, eating too much or too little. Difficulty concentrating, remembering, or making decisions. Thoughts of death or suicide. Living with bipolar depression. Caring for yourself and coping with your condition. At times you may feel a bit lost, confused, upset or angry as you try to cope with bipolar disorder and the depression that comes along with it. It's completely normal to feel a range of emotions. And it's normal for your loved ones to experience different emotions, too. Your healthcare provider is always the best person to turn to for help with managing your condition. The following information provides some starting thoughts that may give you a better understanding of bipolar depression. so you can prepare for issues that come up along the way. Keeping track of how you're feeling day to day may also help in your process of managing bipolar disorder. Thanks for watching. Like it, share it with your friends and families. To make sure you will get our upcoming videos, then subscribe now our channel by clicking right here.